assisted dying is not the answer to a health system that cannot cope with the demands upon it for palliative care. We should be fighting, demanding better economic growth. We should be demanding a more dynamic economy so that we have the resources to invest in palliative care and in good medicine at end of life. And the reality is that, as you say, very few people actually get access to it. I think there are two things that we need to look at. We need to look at the fact that people are not getting the palliative care that they need. But palliative care, even when it exists, is not all it's cracked up to be. I mean, this is something that Sam himself actually recognises, and says that, a lot of these end-of-life protocol abuses actually go on in hospices. But people wouldn't expect that to happen. And I think the general ethos of the hospice is good, but there are, bad players everywhere. And I think we've seen what happens on the end-of-life pathways where people have been, sedated, food taken away, drink taken away, they deteriorate, all the medications are withdrawn. And the end is a very long and horrific death. And even when the drugs come in, it could be days before the person passes away, and often in terrible suffering at the end.
Yeah, and I was really struck by the fact that one of the arguments of the people in favour, one of Sam's arguments, the doctor in palliative care, was that, end-of-life protocols and DNARs are being imposed without informed consent, and people are dying, without having consented. So because it's so broken with the end-of-life care, therefore we should bring in assisted dying. But I'm thinking, if you can't trust the system to implement humanely what we've already got, we can't have this.
Well, absolutely. And I have huge respect for Sam. All his work in exposing, the ongoing livable care pathway, because the practices are identical and it's happening now. They were ramped up during COVID, and those precedents have been set. And to know that and yet still advocate for assisted dying, I think, he's a man with a good soul. As you said, these people have come from a point of compassion, but I think they are naive. And I think in some cases, and they're not looking at the economic, political and cultural context in which this will be exercised.